Today I want to talk about who can benefit from home health physical therapy, mostly based on kind of diagnosis codes alone. So I've been a physical therapist in home health for about 8 years, seen a very wide variety of diagnoses and treated them in the home. And so I just want to talk about some of the top few diagnoses that I would say are seen in home health. So the first one would be post-hospital stay, whether that's generalized weakness or an orthopedic issue or a exacerbation of a chronic condition such as COPD or heart failure. Those are definitely people who are going to benefit from that next step in their rehab process of having therapy in a home environment. And it's not going to be as frequent as it was in like a skilled nursing acute rehab facility, which is usually 5 to 6 days a week of therapy, but it's going to provide them with some follow-up at a higher intensity than an outpatient clinic or just having no further support when they come home. Orthopedic diagnoses are pretty common with home health. I feel like it's actually become a little less common, but maybe that's just my territory or just how things have been recently. But hip fractures, shoulder replacement, voluntary hip replacement or knee replacement, those are typically diagnoses that we can see at home. Sometimes that's even just for the first couple of weeks after the surgery. They may not need that full 60-day period in home care, and maybe just the first couple weeks when their mobility is lower, and then we can transition that person to an outpatient clinic that's going to have some of the equipment and things that we can't bring into the home and might help them get back to their previous level of function a little bit better. The other one would be heart failure. People come on to home health, sometimes nursing, sometimes just therapy with post heart failure exacerbation, and usually that's to return to their level of endurance that they had before, work on some strengthening, work on some breathing control and swelling management techniques that can help them to progress back to their previous level. Another one is diabetes, typically not a direct therapy referral, even though exercise has huge benefits for diabetes. A lot of times people will have nursing and therapy if they've been in the hospital for a hyper or a hypoglycemic event that led to weakness and a change in condition. Post falls, so even if it's a non-injury fall, that's a common diagnosis for sending for home health therapy, kind of helping us assess the environment, their physical factors. Maybe there's some dizziness involved and we can help manage the orthostatic hypotension or BPPV or other causes of dizziness. It's nice to have home health for falls management because environment is a big piece to that. I do talk about that in my course that's available on my website, that environment makes a big difference. So it's nice to have the home health side of it to come in and see what we can do to make the environment safer, whether that's adding grab bars, changing their assistive device, maybe adding a night light to a pathway that's difficult for them. Some ideas that it's nice to see that physical environment and make those decisions together with the patient. And the other one would be neurological. So post-stroke is a common one, especially if someone's returning home from that long stay in rehab and needing to really reacclimate to their environment, doing some caregiver education for safety in the home, making sure that transfers and walking and the whatever level that they're at is safe in that home environment. Parkinson's disease is another really common one that I see a lot, and especially kind of long term. Sometimes those patients will admit for a few months and we'll get some progress, and then maybe their condition changes as it progresses, and we might see them again in 6 months or a year for another kind of spout of therapy, make some changes to their plan of care, reassess what level of condition they're in and what their mobility goals are at that point. So those would be kind of the top few diagnoses that I would say I see on a regular basis.